everyone. I'm truly honored to be able to introduce Governor Josh Green as our opening keynote speaker. He is the governor of the state of Hawaii with over 2 decades of experience in healthcare delivery. In addition to his years of policy work, Dr. Green formerly served as lieutenant governor of the state from 2019 to 2022, as well as a senator representing District 3. Just a huge thank you to Dr. Green. I know that many of you are familiar with him and his work, and I'm so excited to have him be with us today. So please give him a round warm welcome.
Thank you. Aloha. So great to be with friends, and thank you for the warm welcome. I remember more than a decade ago when we had early conversations about a conference of this magnitude, bringing together health leaders and big think folks. We had it over a coffee with a group that I was working with in the past, a physician group, and it just really was extraordinary to see it blossom and grow. So I'm really grateful to be here today and to provide somewhat of an update of just where our state is, what we're thinking. I see the list of people that are going to be speaking today, and it's just amazing to be amongst them, to possibly set the stage now, but also to imagine what will come from that conversation about the AHEAD grant, which is going to help us continue to lead in our state and to transform healthcare as we know it. I was sharing, and this is before I get to my formal comments today, that we have the luxury in Hawaii of being able to be forward-thinking and trying to be a trailblazer state on healthcare because of the shoulders we've stood on over the many, many years in the past. And I'm thinking about something that was 50 years ago, now almost 51 years ago, 1974, when the state of Hawaii passed the Prepaid Health Act. And to imagine the vision they had then to get everyone, or functionally everyone, insurance so they could get primary care and be out ahead of their diabetes, out ahead of their health disparities that we now talk about now, out ahead of hypertensive crises and renal failure. That set the stage and made it more possible for us to also innovate on things like tobacco policy, primary prevention. And honestly, I think because of those moments way back, we've been able to bring leaders together, whether it's from insurance at HMSA, our health groups, PMAG, I saw some friends there, and Hawaii IPA, our team. Everyone gets to get together, and we have the luxury of bringing Jack Lewin back into our mix, who probably was one of the sponsors of the early initiatives that got us out of the gate. So again, thank you. Thank you for being here to support Hawaii and for healthcare across the globe. Now here's just a few observations that I thought I'd share. As everyone knows, Hawaii is considered the health state. If you look at the data, we have the longest lived people, and it's not just because we've had insurance for everybody, or that Asian people, Japanese relatives of mine will never actually die, it appears, but because we also are able to focus on other ethnicities and groups. Jamie, my wife, is a unique combo, Japanese, and I will tell you, in our family, we see this play out. Her aunties and uncles who are from her Japanese lineage are living 10 or 15 years longer than her uncles from the Big Island that are Hawaiian, or her mother, who passed at the age of 42 because she was unable to get an early diagnosis of a gastric cancer. So even in our first family, so to speak, we see these disparities play out. And I believe deep in my heart that what it comes back to is what we see here. And I try to tell people when I'm on the mainland that we have advantages like no other. People can be outside, they can exercise, they can focus on nutrition. We have diversity. But the truth is, we also have really begun to focus deeply on social health. And when I glance at that triangle that we've been talking about and working up and helping to evolve, I think, for example, when I see Jennifer, who's a dear friend from HMSA, I sometimes don't think so much about even the insurance plan that we did for kids who have autism, though that was an extraordinary moment. I think more about the homeless shelters that she and other organizations are sponsoring and providing nursing care and social work care and getting people off the streets so that they can live longer. And that's smack dab in the middle of our social health model. So when I look at that, the first word that pops for me is Alice, the Alice families. those who are living with an asset-limited existence here in our state, they have no extra money at all to care for themselves. They can't pay for extra insurance. They can't pay for co-pays, perhaps. They can't pay for their medicines. They struggle to get any kind of nutritious food. They may never buy fresh vegetables, ever, because it's expensive. But the moment we can do something for them, and I'll get to that in future slides, their healthcare, all of their healthcare data will improve, but their lives will improve. And so I look at that slide and I think to myself that that's really what healthcare is. It's dealing with homelessness, it's dealing with Alice families. Of course, it's supporting hospice and community health centers and making sure people don't experience trauma or sex assault or any number of social ills that will either cause severe depression, self-medication, addiction, but that's where it's at. And I think if we continue to find models, perhaps like the AHEAD grant, if we find models that allow us to focus on these issues, we will end up spending a lot less energy struggling to find enough resources for end game things, whether it's a surgery, helping decompress a bleed that comes from a blow to the head, perhaps in the domestic violence setting, or prevent someone from getting super drunk and crashing their motorcycle without a helmet and ending up in the ICU. If we help them with their lives here, I believe that that's healthcare policy. And so that's what Hawaii has been able to be a national leader on, and it's why I'm really so appreciative of Judy from our team and Jack from our team, Michael from our team, all of our healthcare people. It is amazing to have the luxury as a governor to be pushing out these ideas through great thinkers and letting them run with them. And that's how we're going to continue in Hawaii, make our attempt to lead the rest of the nation and top all the charts on what outcomes can be if you do the right things. And when I say all these names, I also have my directors here who align. I've worked with Ryan Yamane for now 20 years. We came into the legislature exactly the same day. It was 20 years ago yesterday that we met. And it's just really fascinating to see people still stick with these challenges because they're where our hearts are for our state. So as we go through and we reflect on where we are now, there's other practical parts that have to fill in. We have to put meat on the bone to make these programs work for real. I've long felt that one of the benefits that we could offer people is direct support with the workforce. And so we came up with the idea, and I'm not shy to say it came from experience. When I was here at first in 2000 with the National Health Service, they paid my loans to go work in Ka'u on the Big Island. They said, "You're going to fit right in," which was quite the moment, I can tell you. I inherited immediately 8,000 patients when I became the primary care physician in Big Island, and you guys have heard this joke maybe once or twice. For those of you who haven't, I had 4,000 Filipino patients, 4,000 Hawaiian patients, and 15 witness relocation patients from New York City. And that was my base of care for years. And I was able to try to cobble together care, but I needed social workers, I needed nurses and LPNs and nurse practitioners and so on to even begin to scratch the surface of need there. So I was the beneficiary of the federal loan forgiveness program, which allowed me to come and work here. And now what we've done is we've basically recreated that in a way that's flexible for our state. So we have the HELP program, Health Education Loan Program. And we did $30 million in the first 2 years and over 900 scholars. They have a 2-year commitment. All we asked was that they have to care for those who are on Medicaid and Medicare. That was our condition. We didn't distinguish in this case after learning some lessons whether they had to be specialists or primary care guys, because we know our community health centers need to refer to specialists that will take Medicaid and to provide that care when a PCP, whether he or she's a family doc or a nurse practitioner or a PA, we couldn't do it all. So that was our criteria. We have $30 million in the budget again for these next 2 years. And because it's so well regarded, Mark Benioff, who just gave us $100 million for Straub, which was amazing, and $50 million for Hilo, this guy is incredible, he also gave us an additional now $5 million to do these loan forgiveness programs. And that's a lot of providers. And all that extra $5 million will go towards loan forgiveness for people on Big Island, where the disparities are the greatest and where the shortage is the greatest. It's about 40% or has been. We have good news though, it's working. We noted that a year ago we were at 17% short for all of our healthcare disciplines. We dropped to 14% short in just 1 year. Give me 5 years of this, and we will have a functional zero shortage of healthcare providers in the state, which will put the onus on all the rest of us to actually deliver on all these things that we believe in, because our health philosophies will now have a translatable effect with all these providers. So we did that. We provided rural health infrastructure by adding extra dollars to Medicaid, and the Medicaid expansion is something we're passionate about. We went, as so everyone knows, from 1 in 6 people on Medicaid back about a decade ago. If I'm correct, it's closer to 1 in 3 now, and I'll have Judy clean up any of my comments at the lunch hour, where I won't be here, so you'll be safe, Judy. But the point is, we believe in getting care for people, and we would love to have a system where no one even needed to get support for additional healthcare services, but we know what the realities of our world are, and we want to help people. Of course, that's one of the things I'm going to be looking at as we focus on what comes from the new administration. Not political, I'm not going to be partisan, but I'm going to fight for people who have need. And I think that that's something that we all can lend our voices to. This is a big room of heavy healthcare thinkers. Lean in to your states, whether it's Oklahoma or Hawaii or New York or Pennsylvania or Washington State. Lean in, because the more pressure we put to give people care, the better. So we did that. We expanded Medicaid. We signed innumerable healthcare bills, but mostly what we did was we took our views of healthcare and access for people, delivered on that, and then pivoted to the other things in that triangle, like being able to survive. So housing is our key healthcare initiative, really, in the state of Hawaii, because everyone, if you talk to them, will tell you that we just don't have enough housing for people. So if we don't have enough housing, or it's way too expensive, then nurses can't afford housing and we're short. We don't have enough housing and people end up homeless. They're on the street at $80,000 per person per year because they're only going to the emergency department. They're getting staph infections. They're definitely not getting any preventive care, and they're suffering trauma and addiction. So that's how we're really focusing, and that takes us to the Kauhale word, which is really village, is what it means. We've now created 17 of them, 17 Kauhale in just 2 years, and we will exceed our goals. We were only going to do 12 in the first term. And so we've already done 17 just in 2 years. And the purpose of that is, I will tell you, there's a woman who passed away 2 days ago. I'll tell the story in the State of the State address coming up next week. Beautiful person. She asked us to tell her story. Somewhat elderly, in her 70s, and she was on the street homeless. She had been feeling aches. Turned out that she had a pretty terrible stage 4 malignancy. We put her into a Kauhale at her request over in Waimanalo. She started to get care. She went through chemotherapy for 18 months. She was able to re-engage with her peers, her family, society. She had no pain. She got pain management. She did it from a village, so she didn't ultimately, when she did finally pass, like I said, on January 12th, she passed with friends and people who loved her. And that was a very different pathway and different story than she would have suffered otherwise on the streets of Honolulu. And so she's just one of thousands of examples of how we can help people. Many people are restoring their lives and are back in the workforce after getting that, and their health care has been restored, and they are no longer addicted because they got treatment. And these are the solutions that we believe in, whether they come through our Kauhale program or through the community health center programs that have been great. That's where our the bang for our buck is. And so we're going to keep doing those things. And then finally, I wanted to comment on the COVID response. Hawaii bonded over COVID because all of our healthcare team worked together. And each and every morning before 6 a.m., 20 to 25 of the healthcare leaders, chief operating officers, medical directors, you name it, would come together and quickly say how many patients they had, how many hospital beds were available, where we had the capacity to care for individuals that might get sick, where we could get vaccinations done that day. And so we ended up having ultimately just under 2,000 fatalities when we had projected 5,000 per year. So we were projecting over 15,000 lost loved ones. We ended up having 2,000 people succumb, mostly to the Delta variant of COVID. And it was just through good public health and through communication. And that's what you can do in a state like ours, or really even in a country now that we have technologies. So this is how we're approaching things. And we're using the same model, and have used the same model for Maui. Resilience through connection, and you can see we're accelerating the recovery probably about 80% faster than any other state ever did We settled the cases within a year. We're building housing already. Everyone within 13 days was out of the congregate sheltering. And I just say a prayer for Los Angeles, because what they're about to deal with is at least 10 times worse and bigger than what we did, which is why we're going to offer some support. And whatever the best ideas we have are, they're very different than us, but there are some things I've already been able to share with Governor Newsom and his team about just making sure you protect people and their property as they transition from this crisis to the next phase of recovery. And so they're already doing some things that you guys helped me to learn, so thank you for that. These are some comments about infrastructure. The state of Hawaii, the state hospital is going to be central to us, but so are all the rural hospitals, Kona Hospital, which ultimately will be replaced. And probably it'll be partnerships and a consortium perhaps. People make investments, but we have to protect the neighbor islands because they're the backbone of our healthcare system. I shared what Mark and Lynn did over in Hilo, and it really happened in large part because of what Ray Vera did and his ability to communicate the need at Straub and to get support from the Benioffs. So kudos to Ray and to Mark and to everybody who's fighting for these extra appropriations. They will save people. And as we saw with the explosions here in Honolulu the other day with the fireworks, and we saw extraordinary response from the medics and the fire and the police folks. I tried to explain that to people yesterday, that just like everyone pitching in and taking people to different areas of expertise, that's what we have to do with the neighbor islands, where you have a very small clinic, perhaps in Pahala, where Auntie Jessie did work for decades, or in Kohala, where we have a little ER, and when something basic is going on or core care, we're there for that, and when it gets more severe, we of course have to take it to the next level. And that's what we do in Hawaii, and that's what we do in our country, which is why we were also able to loop in the fire consortium that included care in Arizona. So if we come together like this, especially since we all know somebody in the system, we're going to thrive. This was the larger description of what we did with our healthcare workforce. You can see we have 4,000 healthcare providers short. The $30 million giving up to $50,000 per person per year if they really need that much, repays their loans. We're allocating these dollars so that nobody leaves, because we can actually grow our own workforce, but we don't really ever have the full economic ability to keep them here. That's always one of our great challenges, and we will do our very best, but this is meant to be the catalyst to get that done. And then you see over there on the other side of the slide, that's actually me at the Kauhale that was just outside of Washington Place, the Health Kauhale, and we may actually bring one back, either there or on the grounds, perhaps, of the state capitol. I've had some requests from some of the legislators now to do that. And that's just testament to how this can work, to help care for people. But you can see that enhancement in Medicaid dollars, that was the recommendation of HAH, Healthcare Association, mostly led by Hilton in this case, that really brought a lot of extra resources to care for the people who are in greatest need. This was the picture of tackling homelessness. You can see the 17 Kauhale that had already opened by the end of last week. And we will certainly get to the 30 over the next 2 years. We have so many of these now teed up, usually supported by philanthropy, that we almost can't find enough construction workers on their free time to build them. And every time we build one, someone else calls me. I got a call from The Rock the other day who said, I got UFC to give you $1 million. I'm throwing in $1.2 million extra dollars to get one of these Kauhales done, because I just believe in it. And I mean, I'll tell you, The Rock is cool. He is a very, very cool guy. We did lament the creation of the movie Tooth Fairy, however, together. But Moana is fantastic, and I'll tell you, that guy has got a heart of gold, and we're going to be doing a lot of projects together. But this was just one of them, and you can see there are global leaders that want us to help people, and when we do the right thing, they pitch into. And we're already also going to get some support from Zuckerberg, who is taking up residence in Kauai 2 months a year. Oprah's been supportive. They see what we're doing, is I guess what I'm trying to say. They see that your heart, as it goes into the healthcare system, deserves to be rewarded. And that's how we're gonna build these facilities and these programs, even if we don't have every last dollar that we would dream of, perhaps from the federal government or even the state government. You can see what we're doing statewide on housing. 1 in 4 residents can't afford housing. People spend much more of their money than they can actually afford to stay in the state. It should be less than 30%. A lot of times people are spending 50 or even 70% of their resources on housing. That's got to change. And the average housing price is $800,000, which is $400,000 of red tape, just so you know. And so we can cut the red tape, but it's really, really difficult to build large housing projects quickly. It's actually much more difficult to do that than come up with health innovations. But we're on that, and with a couple extra years of support, I'll be able to do it. We used emergency proclamations because I'm restless, and I don't like to necessarily wait. Sometimes other people have to catch up to us, but they've been terrific. The legislature has really taken this on, and they're contributing to our health needs, and that's Marcia Fudge, the immediate past HUD secretary, who is going to stay involved, and she understands what I'm talking about and what we're talking about when we talk about healthcare reform. When we talk about getting money to people who are struggling, this is it. The legislature gave us basically over $7 billion in tax breaks over the next 8 years. And this thing is a shock to the system, even to me. This even made me light up. We asked for significantly less in tax breaks because we didn't think we could possibly get something of this magnitude passed. This is the answer to helping Alice families be able to afford health care, to really create a life that they can make choices in for their own health care and their kids' education and so on. So this, where we go from the second highest to the fourth lowest tax state in the country, is the game changer. This is what will help people. Thank you. You're welcome. I appreciate that. This, combined with the very long play of doing early education, I don't know, it's not as sexy, but I'll tell you, doing early education for 3-year-olds and 4-year-olds, getting them ready for school, means that they're going to do a lot better. And we ultimately will see decreases in Medicaid need because of that. So we're doing some structural things that go even beyond the borders and boundaries of our hospitals and our community health centers and what we can come up with at the macro level. And we may never even see this in the notes of our administration for 15 or 20 years, but these kind of changes, hopefully, will make it possible for people to really adopt the ideas that you guys are going to come up with over the course of this day and the course of the coming years. Just a few pictures of what we have done. One, there up in the upper right, is me actually just examining a guy and he was in congestive heart failure, but we were managing it for free at the Kauhale, right across the street. No admission. This guy normally would have been admitted in an ICU bed. The other guys we see here in the middle, upper middle, that was 24, 36 hours after Maui burned. And this gentleman had smoke inhalation damage and had first-degree burns on his body. He was homeless, leaning up against a fast food store, I think, in Maui. Couldn't get him to a hospital because the hospitals were overwhelmed. The far upper left corner are two of the people that got the scholarships, the HELP scholarships. One's a pediatrician and one is a GP or a family practice doc, I believe over at Kaiser. And they were working in one of the modular hospitals that got built by the Army Corps of Engineers in the aftermath of the fire. These lower pictures, one's a dedication, of course, and the other one might have been a bill signing where our healthcare community came together to increase reimbursements. And so from a macro standpoint, we can do all these things, but we can actually get our hands dirty and care for people. And in my opinion, that's what I'm honored to do. That's what you guys have been doing for decades. And if we show the rest of the world that this is what we can do, then there'll be absolutely no stopping us. So mahalo from my team, and I'm here for you 24/7 whenever I can be of service. Aloha. Thanks, buddy. Thank you. Good work. Thank you, man. Yeah.
Thank you. There we go. Aloha. My name is Carter Kimble. I get to be humbled. I have had many an opener in my career, but Governor Green actually takes the cake. I get to put this one up on the refrigerator for sure. My role here for the next 20-ish minutes is to kind of walk us through together a little bit of a therapy session, if you will, but it's one that's taking a look at the transitions occurring at the federal level and then ultimately how states navigate those transitions. First, we do have very gracious to have received some messages from elected delegation from the state of Hawaii, Senator Schatz and Representative Tokuda. So I will pause. We've got some video messages from them, and then I'll come back up and we can start.
Aloha, everyone. It is great to join you at the State of Reform Conference, and I want to thank the sponsors for having me. As we begin a new year and with a new administration, I want to make one thing clear. Our commitment to improving healthcare for people across Hawaii does not change. For me, in the Senate, that means making sure that Hawaii continues to get its fair share of federal funding to support providers and patients. It also means protecting the recent progress to make healthcare more affordable, including lowering insulin costs and capping out-of-pocket payments and prescription medicine through Medicare. The good news is that there are several healthcare priorities that Democrats and Republicans agree upon: expanding access to telehealth, improving rural health, and others. Adequately compensating providers in states like Hawaii where costs are higher. Where we can work together to achieve progress, we will, but we'll also fight to oppose any effort to cut Medicare, Medicaid, or any critical programs that people rely on. That is a promise. In the months ahead, I urge you to stay engaged and tell us what your priorities and needs are, because we're here to help. Thank you again for having me, and have a great conference. Mahalo and aloha.
Aloha. I'm sorry I can't be with you today in person, but you and this conference are important, so I'm glad I could participate virtually from Washington, D.C. You know, when people think of Hawaii, they think of happy people who live long lives. And while that is true, the harsh reality, as you know, is that for too many, the disparities are life-shortening. Today, you are gathered to talk about the future of healthcare and grapple with the perennial challenges that keep the perceptions of our people's health from matching their reality. From timely access to care, to preventing provider burnout, increasing reimbursement rates, and improving recruitment and retention, to strengthening our health safety net as a whole. This is both the challenge and the opportunities we face. And as the co-chair of the Bipartisan Rural Health Caucus, I have heard from many of my colleagues whose districts have hospital systems, providers, and constituents facing the same realities as we do. Now, as we talk about the future of healthcare and discussions around health policy on Capitol Hill, I cannot understate the challenges that lie ahead with President-elect Trump and his new administration. With their trifecta control, Republicans can now drastically reshape our healthcare system nationwide, and they're preparing to take full advantage of the opportunity. In the past 2 weeks, we have seen shocking proposals from leading House Republicans to target Medicaid with steep and deeply harmful cuts to pay for trillions of dollars in tax cuts for billionaires and large corporations. This so-called menu of options is just a feast for the rich at the expense of working families and the most vulnerable in our communities. When they talk about Medicaid reform, the harsh reality is, as you know, is that tens of millions of low-income Americans across the country, including of hundreds of thousands right here in Hawaii, could lose or see their coverage cut. Restructuring Medicaid to a per capita cap and limiting states to receive only a fixed amount of federal Medicaid funding on a per beneficiary basis will place a growing budgetary burden on states and make dealing with any kind of public health emergency like COVID improbable. The bottom line is that these cuts are going to force states across the country to make impossible choices between ensuring people in need or supporting other critically important programs like K-12 public education. Whatever the choice is, and it's a false choice, the result will almost certainly hit rural and remote America harder and impact the most vulnerable people in our society, especially our kupuna, people with disabilities, and our keiki. The harsh reality is that Medicaid is likely just the beginning of federal budget cuts that will ripple across our healthcare system. Republicans have committed to slashing trillions in federal spending while cutting taxes for the wealthy and corporations and leaving defense spending untouched. Anyone who has spent any amount of time with the federal budget would tell you this is not possible, not without eviscerating domestic programs that millions of Americans, the people of Hawaii, rely on. What that means for the American healthcare system remains to be seen. But if their past efforts are in education, we are likely looking at repealing regulations initiated by President Biden's administration to improve healthcare quality and outcomes. Similarly, we could see funding cuts to community health centers, maternal and child health programs, family planning services, and health workforce initiatives. These will make it harder for people across the country, throughout our state, to access basic healthcare services they so desperately need. The last issue I want to address is the people who will be shaping this administration's health policy. Most prominently, President-elect Trump has nominated Robert Kennedy Jr. as his Secretary of Health and Human Services and Dr. Mehmet Oz as Administrator of the Centers for Medicare and Medicaid Services. Let me be honest with you, and let me be clear. These individuals absolutely lack the qualifications and experiences needed to serve in these key positions. They do not have a public service heart, goal, or mission. But my bigger concern is a hostile environment for reasonable, science-based public health policy. These are quacks who regularly peddle in pseudoscience and crazy ideas like Wi-Fi causes cancer or that AIDS may not be caused by HIV. We are entering an era in which the leaders responsible for our public health have actively fostered and disseminated misinformation and disinformation with serious, life-threatening consequences. When we give people like RFK Jr. and Dr. Oz a national platform to lead, we make it harder for all of you and your colleagues across the country to do your jobs and provide the quality health care that people need and deserve. Yet, while the challenges are great, my friends, we cannot give up. We must be prepared for the challenges that lie ahead. That includes fighting to preserve the progress we have made and for our values in a more just and equitable healthcare system. Every American, regardless of who they are, where they live, or how much they make, deserves access to affordable and quality healthcare. As co-chair of the Bipartisan Rural Health Caucus, I will also continue looking for opportunities to work across the aisle when possible to advance bills that support the health and well-being of our people. In the 119th Congress, I believe we will have a lot of opportunities to get things done in healthcare. And I thank you for being on the front lines, for serving our people, and for being my partner through this fight. Thank you again for the opportunity to join you virtually today, and I hope to be able to see you one day soon back home. Mahalo, everyone.
So obviously the spirit of the conversation is one that is of, a starting place is one of trepidation, right? There's a lot of uncertainty and unknowns. I want to clarify expectations, like I said, for the next 15 or 20 minutes. I'm not gonna tell you what's gonna happen. That's not because I know and I just don't wanna share. That's also a nod to there isn't a known, right? The modus operandi of this administration from previous experience is not a well-organized, meticulous approach, but instead a little bit of chaos and maybe some of the things stick, right? And so that's kind of a tough place to start from. Where I need to start, my perspective is not one that is heavily rooted within this state of Hawaii. I'm not from here, I don't live here. I was able to go to the Bishop Museum, which was incredible. But I will tell you, really my experience and expertise is in how states navigate federal policies. The good, the bad, the very, very ugly. That is where my experience and expertise is, and so hopefully through that context, I can offer some helpful tidbits as we go forward. First, I need to say out loud and acknowledge, and the governor has already left, so this is not just kissing the ring by any stretch. The governor's absolutely right when he talks about the fortunate place that Hawaii is in because of such massive and progressive investments in coverage for Hawaiians. the spirit of so many innovations through healthcare over the last 20 years have been rooted on a approach that the rest of the country is still dealing with very much so, and that's coverage. You really don't have the opportunity to innovate and do new things within delivery or systems of care until everybody's covered. Eliminating that disparity as an A1 allows this state to do things candidly that many other states could not do. So one is an acknowledgement of that. My credentials as a dad are also of note, as I will be sharing dad jokes along the way. One, the governor queued up for me beautifully. What do you call it when Dwayne Johnson needs to buy something to cut with? Rock, paper, scissors. Thank you. Tip your wait staff. Second, I need to call out a couple of observations from Senator Schatz and Representative Tokuda. One is you can obviously tell who is fresh off of the campaign trail and who didn't have an election this time. Right? Very clear. That energy, right, is also indicative of the broader picture of how the United States Senate operates. Senator Schatz quick to say, I'm going to defend against the bad, I'm going to go look for the good, and there is bipartisan things, right? There are things that are able to be worked on together across the aisle politically. Representative Tokuda, and it's an observation, it's not a judgment. The House is forced to be much more reactive. They are on an election cycle that is irrational and unreasonable in my eyes, but it is reality. And it's one that you've got about 16 real months to do something, and then you have to go run again. So really, when you hear the concern and you know the tenor of the conversation and the dynamic between the two of them, yes, some of it is personality, but some of it is also reflective of the environments that they find themselves in. So that's an important observation that I think we need to carry through, especially as we start talking about later policies that require congressional action. It is much more complex than Republican or Democrat. Much, much more complex than that. The senator also discussed, obviously mentioning bipartisan policies. There are plenty of things that have started in the past. He mentioned insulin costs. Cost of prescription drugs is one of those things that everybody is interested in doing something. The minutia and how to attack that, how to climb that hill, that's where the detail lies, and it'll be interesting to see how Congress is able to navigate some of those things. One of the things I'd also like to bring up for context, in 2017, President Trump had, and the Republican Party had about a 35-seat majority in the House. So they could compromise and lose blocks of voters, right? Under the large umbrella of the Republican Party, there are caucuses that are organized. You don't have to be exclusive to one caucus or another, but there's the Freedom Caucus and the Republican Study Committee and these different elements that kind of represent a spectrum within a spectrum. So within that, the U.S. House of Representatives had the ability to negotiate and allow for smaller groups of Republicans to vote against legislation, knowing that it would still pass. This year, that number is 2. That type of margin in more traditional times and a kind of modern era, the default assumption would be that bipartisan solutions have the easiest path to passage. We are in such a hyper-partisan environment in society right now that my read is actually not bipartisan solutions, but a lot of non-solutions. A lot of can kicking and deferring the mechanisms by which the majority can actually pass laws is definitely going to be through continuing resolutions or authorities that already exist with modifications to go with them. They're going to be really, really challenged to stay in uniformity on the priorities as some go. We're already seeing it in nominations. Representative Tokuda mentioned RFK. As Secretary for HHS, there are more than a few Republican senators. That Republican Senate, by the way, 2 votes. They can afford to lose 2 votes, and then they can't get a simple majority passed through. So somebody like an RFK, who has been fairly out and about a pro-choice stance on abortion, from a numbers perspective, that's a real problem for him in getting confirmed. Does it undo his nomination? Maybe, maybe not. So I think there are plenty of things that really, it's not as simple as kind of the fervor in November may have suggested it would have been. And so that's one of the things. I'm glad to see that you're all here and nobody actually took the jump off of the cliff, right? That we have all taken a step back. I think now is the opportunity to think strategically about what stands in front of us. When you hear things like, so now to the more substantive portion around policy and the conversation of what's out there. There are obviously many fairly blustery comments that have been made around things like immunization policy, priorities being stated around Medicaid finance reform and things like that. Once you take the next step into where those proposals are being formulated, it becomes fairly clear that they are from the hip at best. The package that Representative Tokuda mentioned, House Republicans come out with, have targeted $2.3 trillion in Medicaid cuts over 10 years. That's scary. Once you get under that to see the mechanisms that they use to do that, the reality starts to set in that it's not viable. I say that a little bit tongue-in-cheek to say that something like imposing, not making it optional, but imposing something like a per capita cap, right? I'm going to give you a set number of dollars per Medicaid enrollee, and regardless of their utilization, that's the amount of dollars that you get. That's such a dramatic departure from the way many states operate Medicaid today. In a perfectly executed scenario, it might take a decade to get all states to operate and implement under that model. It is very, very complex and very complicated. And so the House, in a place where they're on a cycle where they have to say things and start moving down the tracks immediately, they have a little bit more latitude in here's a proposal, right? The menu of options. We're going to safeguard ourselves from any political throwback when it doesn't work. This is just an option. We're just thinking about things. You get to that level of detail and it starts to unravel pretty much on its own, because all at the same time, House Republicans are quick to talk about priorities like behavioral health. Many are very interested in justice reform. So things like reentry waivers that Hawaii has recently gotten approved, those priorities can't exist, and you have broad-scale draconian reductions in spending. The other thing that's fairly obvious once you dive into these policy proposals, I dare say that most of us, if we have our balloon, and inside that balloon, the air inside it is representing need, right? Need in the system, utilization, services. These proposals, for the most part, represent squeezing the balloon. They don't represent letting the air out, which is actually what the American people are probably interested in, right? Let's reduce need, not squeeze the balloon to where the air has to go, somebody else gets to shoulder that. Most of the proposals that are put forward in the House Republicans' menu of options are fairly straightforward shifts of funding. They're not actual reductions of these services then won't be provided. No, they'll still be provided somewhere else on somebody else's balance sheet. That then becomes a problem for whom? For states, right? States, especially within Medicaid, pretty much uniformly will say, time out. There are, as an example, there's a proposal around reducing the matching percentage, how much federal dollars you get from the federal government to states for Medicaid expansion. Right now, there is a floor that's established at 90% federal dollars, 10% state dollars for that expansion population. Proposal put forward to reduce that for Medicaid expansion. Meaningful savings on the federal side, and I should have prefaced, they're very interested. The public mandate, tax cut, right? That's how they were elected. Inflation has ruined everything. The economy's in shambles. We need more spending power. Oddly enough, no economist ever has said, oh, inflation's running out of control. What you need is more spending power. That's not how that works. But as an aside, the premise of we've got to go find these cuts is to pay for something else. And it's not replacing the healthcare services. It's tax cuts. So with that as an understanding, the balloon squeeze that I mentioned before, that's really where the rubber meets the road on political motivation of states and ultimately stakeholders like yourselves, but effectively the really, really influential health plans, pharmaceuticals, health systems, provider groups. The writing's on the wall within those reductions that there are real issues in those. And so again, I would encourage some taking a lot of these proposals kind of with a grain of salt. So with the time that I have left, a couple of takeaways. One is we should not forget Senator Schatz's message about what it is and where there are opportunities to work together. The margins, the voting margins in the House and Senate are so tight that there really are opportunities, regardless of how final votes look, for there to be meaningful work across the aisle and for a lot of proposals to really find a true center, if you will. The second, I think that the work that Hawaii has already done, I mentioned this before, but Governor Green is talking about the right things. Housing is just so paramount. The new waiver that Judy and her team got is unbelievable. It is a model that other states, like I mentioned, many can't take advantage of it because of where they are. They've got too many disparities in coverage and gaps to even really take the steps forward. That waiver is going to be so incredible, and I applaud Judy and her team, and the ability to get that done. Receiving approval just last week is just paramount for the state. The last thing that really is more of a strategy piece that I would put forward, especially for this group, and let it kind of be a theme and carry you through the rest of the agenda. It really is when there is an opportunity for healthcare to speak with one voice and to really find partnership and those places where individuals, groups, and others have that harmony, that is so powerful. Whether it's in support or opposition of a proposal, consensus is just something that is so short in the political space these days that if you can find a way to create it, which does not mean you get everything you want, right? That's the biggest thing, is that in order to get there, you've got to give. You have to give. You have to be able to walk into these conversations with that frame of the greater good. This gathering of people is a meaningful one. I would really encourage you to use it to fill your cup. There are going to be challenges. in the next year. And so I would say find that energy from your peers, from these networks here. Don't let these opportunities pass you up. I think, I don't have a clock, I think we can do a couple of questions if there are some, but I'm standing in between you and a coffee and restroom break, so I acknowledge that as well. With that, thank you for sharing your time with me today, and